coughing, sneezing, or even more severe symptoms? Maybe it's time to pay a visit to the doctors. In a survey presented in the US from 2012 to 2018, the average number of patients seen were 20.2. However, some physicians saw more than 60. In such a fast-paced environment, it is important that the information conveyed must be accurately understood by both the physician and their patients. I'm sure most of you are very familiar with much more popular terms, such as the flu or bacterial infection. However, what if someone had a less common condition? For example, what is aphthous stomatitis, or even this word? Chances are, most of us have never even heard of these terms, much less know what it is. Although it is primarily the physician's responsibility to be able to decode and explain these conditions, patients also have an equal responsibility to make sure they understand what it is. After all, what's more important than taking care of your own body? Our entire healthcare system heavily relies on the assumption that patients can understand these complex written and spoken medical information. However, if patients don't understand a diagnosis, their treatment plan, or how to take their medications, their visit to the doctors isn't likely to lead to better recovery or health. Let's take a look at this true story that took place. It first started off with a public health nurse asking her patient, Jill, I see you're taking birth control pills. Tell me how you're taking them. Jill then responds, well, some days I take 3, some days I don't take any. On weekends, I usually take more. Her nurse then asked her, how did your doctor tell you to take them? Jill then responded, he said these pills were to keep me from getting pregnant when I have sex, so I take them anytime after I have sex. She reads at about a 2nd grade level. Evidently, this patient had a huge misunderstanding in regards to what the doctor had told her. To the doctor who has thorough knowledge about medications, it might seem clear, but to Jill, it would have been helpful to explain how long after sex she should take the pill, how many, and the time frame that followed. This case sheds light to the communication barriers, which, unfortunately, often go undetected. In the same research paper that highlighted the previous case, it was shown that poor literacy skills are actually one of the most prominent indicators of health outcomes. Patients who have low reading fluency are shown to know less about their chronic diseases, are worse at managing their care, and are less likely to take preventative measures. This is even more alarming considering the fact that 58% of adults aged 16 to 65 possess only basic literacy skills to get by everyday tasks. This implies that 2 out of 5 Canadians, which is 9 million people, can't read well enough to carry on day to day. If you add in those aged 60 or above, this number jumps to a massive 12 million. Unfortunately, this isn't the only problem. In the US, it was found that only 36% of doctors asked an open-ended question to patients for them to describe their symptoms. Asking closed-ended questions does not give the patient an opportunity to describe how they're feeling in detail. Additionally, this undoubtedly leads to some bias from the physician's end on what they might suspect the condition to be. Even more surprisingly, out of the 36% of those who did end up asking open-ended questions, patients received a median time of merely 11 seconds to respond before being interrupted. A separate study later showed that Canada has the same problem as well. Although these are just some of the factors in a complex web of patient-to-doctor interactions in the healthcare setting, it is crucial that both parties are made aware of these problems and to minimize them. So, what exactly can be done? For doctors, you should ask more open-ended questions, such as, what brings you here today? Or, how are you feeling? Have the patient repeat after you to make sure they understand, slow down during technical areas, and most importantly, to create a psychologically safe environment to foster an atmosphere in which questions are welcomed. Going back to the terms mentioned in the beginning of the video, aphthous stomatitis can be described instead as a non-contagious mouth sores. You can also incorporate more common names, which in this case is canker sores. Sphenopalatine ganglioneuralgia is actually an ice cream headache or a brain freeze. As patients, you should also take the responsibility to make sure that you understood your physician 100%. That's right, not 90% or 99, but 100. To ensure this, make sure to always clarify if you're unsure. And don't be scared to ask questions. Remember, doctors are there to help. And for those who aren't fluent in English, or have English as a second language, there are interpreters that certain clinics can provide. Having a good health is a quality of life that no amount of money can buy. The next time you're sick, remember to always keep this in mind.